was a scheduled meeting of the president and a group of restaurateurs. Then at the end, almost as an afterthought, Donald Trump dropped his medical bombshell.
The frontline workers, many are taking it. I happen to be taking it.
Hydroxychloroquine?
I'm taking it, hydroxychloroquine. Right now, yeah. A couple of weeks ago, I started taking it.
Hydroxychloroquine, the anti-malarial drug that the president's been pushing with no scientific evidence as a potential cure for COVID-19. And why is he taking it, given he hasn't actually got the virus?
What do you have to lose? Okay, what do you have to lose? It seems to have an impact, and maybe it does, maybe it doesn't. But if it doesn't, you're not going to get sick or die.
But US medical experts have warned that hydroxychloroquine could have harmful side effects, potentially causing heart problems for coronavirus patients. And the Food and Drug Administration says it shouldn't be used outside of hospitals or clinical trials. Not for the first time, though, the president is ignoring the advice.
This is, as far as we know, a useless medication for coronavirus prevention and treatment. And the President of the United States should not be suggesting otherwise, let alone using his own body to suggest it in the most powerful way.
The top Democrat, Nancy Pelosi, was a little more pointed.
He's our president, and I would rather he not be taking something that has not been approved by the scientists, especially in his age group and in his, shall we say, weight group, what is morbidly obese, they say. So I think it's not a good idea.
In a statement released by the White House, the president's doctor said he and Mr. Trump concluded the potential benefit from treatment with hydroxychloroquine outweighed the relative risks, though he did not explicitly say he recommended President Trump take the drug.
Hydroxy.
He didn't need to.
Chloroquine.
The president has been touting its alleged benefits since March.
It will be wonderful. It'll be so beautiful. It'll be a gift from heaven.
At one point, causing a run on the drug for patients who legitimately needed it.
And then I said, supposing you brought the light inside the body.
And who will ever forget his most memorable medical faux pas?
And then I see the disinfectant, where it knocks it out in a minute, 1 minute. And is there a way we can do something like that? Injection inside or almost a cleaning.
He later said he was being sarcastic, but it's no joke. He's now apparently so worried about catching COVID-19, he's decided to take an unproven malaria drug, even as he tours factories and refuses to wear a face mask as the most basic form of protection.
Well, it was the emergence of 2 cases of coronavirus inside the White House that reportedly had the president so worried that he decided to take this drug even after those warnings from the health experts. The problem is that just as the disinfectant makers were forced to issue statements warning people not to take the president's words too literally and try and ingest lethal chemicals, the same worry here that having heard the president say that this drug was okay for him, that other people would rush out and try and take it too. That's what's got the medical experts so exercised today. And it's why the White House was forced really to issue a statement saying that even though millions of people do take this drug for reasons other than malaria prevention, but that any use of the drug has to be in consultation, it said, with your doctor. You have to have a prescription. Incredible, really, that in that context, that the president, given his age, he's 73, and given what Nancy Pelosi there referred to as his weight group, that he even managed to persuade his doctor to prescribe the drugs for him. One suspects the doctor wasn't left with much choice.